came up with that idea because we thought it was real important for leaders to be involved in change. That is one of the leaders' responsibility, is to act as a change agent. And so we thought it would be a good idea if each of the participants took a topic or an issue of concern that was of interest, particularly to them, and then work through a whole year in terms of bringing about that change and actually doing an action research project. Now, action research doesn't mean they're going out necessarily and framing a question and gathering data and conducting some complex analyses. They do some data collection and they do some framing of questions, but it's much more relaxed than that, much more reflective, much more explorative. And we think it was a good experience for each of the participants that were involved in it, and they agreed with us. It was a little daunting in the beginning, so you may feel that at first. But as you walk through it, we want to make sure that it's something that is a learning experience for you and not just an extra bit of busy work to run you crazy. So to that end, we've asked 3 of our alumnus to come this time and talk to us about their action research experiences. We have Ernest Anderson from New York, and he's going to talk a little bit about a university-based certification therapy program for mental health professionals and how he worked on that program, the great outcomes that he realized from that, and then talk to you a little bit about some of the challenges with getting through an action research project in the day-to-day life at work. Valerie Ayers from New Jersey is going to talk about, the title of her project was No More Legal Orphans, and she's going to talk about what are some strategies for improving permanency outcomes for children who are actually free for adoption and for whom neither adoption or legal guardianship had even been processed or steps had been made in that direction. And then Tamika Williams from North Carolina is going to talk about factors contributing to disproportionality in that state. And so these are some of just, and I give you an idea of some of the directions that individuals took, how they worked through the project. Please jot your questions down as they're talking, because it's meant to really give you an opportunity to talk to them about how they went through the action research experience, what some of the challenges were, the lessons learned, and just how, again, they made it from day to day. So we're going to start off with each individual. I want them to, again, introduce themselves, give the title of their presentation or their action research project, and then just kind of give us the goal of what it was and some of your most significant outcomes. And we'll begin with Tamika Williams.
Thank you. My name is Tamika Williams. I am with the state of North Carolina. The title of my project was Disproportionality in the Child Welfare System, the North Carolina project. And the gist of what I was looking at was trying to how I framed it was we have 8 initiatives, policies, philosophies, thank you, in the state of North Carolina that we have implemented or been practicing over the last 10 years at least, if not longer. And I wanted to see those 8 things, how were they affecting, or did they have an effect on our disproportionality stats in the state of North Carolina. And what I did was I looked at 12 counties, and I had a sample that I presented just for the MALDI experience, showing how those initiatives, policies, practices had been incorporated in those counties and what the effect, if any, had occurred as related to racial disproportionality. And what I saw was that we still continue to have an issue, if not more of an issue, with our numbers getting larger and larger percentages of African American children entering care, staying for longer periods of time, and then exiting without permanency options. And so that's what I was looking at. And in terms of the Action Research Project, and as Dr. Harrison said, it was a very good process. It was daunting to get started in and to look at what we were charged with trying to do, and it encourages you to ask a lot of questions and journal and think about it, and then try to do some little implementation, and then it poses more questions for you to reflect upon. So you're constantly in this critical thinking mode, which is good because that's what you want to foster for yourself. And you don't always come out with answers, and that's okay too. But at least you're posing the questions and bringing them to the attention of other people. And you're as good as the people who are around you, so they may have some thoughts around an area. So I think that's what I would say about the action research process, that it was a good process. It was daunting at times. And do you want me to say something about findings? Is that what we do?
Yes, some of the findings.
One of the things I think for North Carolina that was most important for me, because we have such creative, innovative, and we're always thinking about what we can do around the arena of adoption, what I did see was a proliferation of general child welfare initiatives does not necessarily yield targeted outcomes that you're looking for African American children. You have to do a lot of targeted things, look at individual communities, what is going on with that community, build relationships with your clients and with your families and with your staff to hopefully make some differences and some changes. And many of our agencies that have done some of the breakthrough series or working with the family to family or fully have implemented what we call multiple response system in North Carolina, they are asking some of those most critical answers as to how they do targeted outcomes for some of their most disenfranchised populations. The other thing that I think I saw, of course, was poverty has an effect on what we're seeing, even though our system is supposed to be set up, that not necessarily because families find themselves being with economic deficits that their children are ending up in care because they have limited resources. That is something that was happening in the state of North Carolina. And one of the things that I saw for myself was African Americans have greater success, and you'll see this on my slides, when families are able to maintain faith, community, and family connections. When these traditional cultural norms are significantly severed, other society supports do not manifest and support them in ways that they have traditionally known them to do, or families to do.
Okay. Yeah, and just to remind you, their PowerPoint presentation, copies of their slides are in your packet. Okay, thank you. Ernest, could you tell us a little bit about your project and some of your significant outcomes?
Sure. Good afternoon, everyone.
Hi.
I'm Ernest Anderson. I'm an adoption specialist with the New York State Office of Children and Family Services. Our project was to create an adoption therapy training program for mental health professionals that was university-based and that would offer some type of university certification for the students who went through the program. This work product was a result of a work group that was formed about 3 years ago, or 4 years ago now, where we brought together the adoption specialists from across the state, and there are about 10, 11 of us, with stakeholders and other advocates in the adoption world, to not only look at this program, but other issues related to adoption practice in New York State that needed to be addressed. Initially, I was on a committee for developing better permanency planning services for our children in our juvenile justice facilities, cross-systems collaboration. But when the MALDI project came along, I was asked to be the coordinator for getting this project off the ground and to the condition it's in now, which is fully funded for the second year, which started, the second year started in September. Some of the challenges. Well, my role was to help my mentor, who was also a deputy commissioner, was a deputy commissioner in our home office, with some of the work putting this program together. She'd be in the negotiating end to help with the funding, with our Bureau of Training. My piece was to help the university that came forward, Hunter College School of Social Work, to get their program up and running, stay on top of them in terms of the curriculum that they developed, and stay on top of them to get their budget in, things of that nature. Some of the tasks I had to do to get this work done, we did what we call an informational forum just about 2 years ago to, one, let the universities in the state know that this is a project we're looking for someone to partner with. Hunter College was in attendance, as were other universities. They came forward with a program that was pretty much ready to roll, fortunately. Another task I engaged in was to survey our adoptive parents and what their experiences were with adoption therapists. And generally speaking, their experiences have been less than positive. One statistic that came out in our survey was that 20%, only 20% of the parents that responded to the survey felt that their therapists were competent in adoption areas. Now you can imagine if you asked their parents about their pediatricians and you got the same level of satisfaction, there'd be an outcry, rightfully so. But moving forward, now we're in our second year of this program, thankfully, but there are challenges moving forward. One, the target audience is not quite the audience we had hoped for. Because the funding for the program is primarily, almost exclusively, through Title IV dollars, the attendees had to work for an authorized agency serving children in foster care or work for the local district. Initially, we were able to bring in therapists, private practitioners, who wanted to pay full tuition. The state helped to subsidize the tuition of the local district and agency staff who attended the training. They only had to pay half the tuition. But for the second year, we were not able to allow private therapists to come on board because of restrictions. So those would be the primary findings. Yes, we have a program, but we do need to work much more diligently to, one, make sure the program is sustained, and two, expand it beyond Hunter College School of Social Work into universities across the state.
Thank you. Valerie?
Good afternoon. I'm Valerie Ayers, and I'm from New Jersey. I'm currently the Youth Permanency Coordinator, and the name of my project was No More Legal Orphans. The State Makes a Poor Parent. And basically, I was looking to develop permanency strategies for the older youth. I was really looking at finding ways of helping our legal orphans achieve permanency. Now I have to describe to you what I am considering legal orphan. I am considering legal orphan for the purpose of my project those young people 14 and over whose parental rights were terminated for the purpose of adoption, but for whom we never found a family. And right now, we are no longer looking for a family. So that's my legal orphan description. And in New Jersey, as of the time that I did my project, 304 young people fell into that category. So basically, the statistics that we hear about in terms of our young people being discharged from the public child welfare system without that safety net, we're hearing that these outcomes are very bleak. Okay? We hear about homelessness, pregnancy, unemployment, criminal justice system. We hear about things like that. So we know that we need to do better. And in New Jersey, 66% of our young people, first of all, who are in care are African American. But then when you look at the legal orphan population, it jumps to 75%. So 75% of that legal orphan group is made up of African American children. So we know we need to do better. Now, there were 3 objectives to my project. First, I wanted to determine why the legal orphans did not achieve permanency. Then I wanted to work with those young people coming into the system, work with them and their families to make sure that that we actively work towards their goals. If it's being reunited with their family, we need to actively do that. If it has to be a concurrent goal, we need to do that so that these young people coming into the system don't end up the legal orphans of tomorrow. And then lastly, I wanted to try to develop strategies to find families for that legal orphan population. Okay. And some of what I did around my approach, first of all, I had to make myself aware of what was going on out there. So I read everything I could get my hands on. I listened to experts. We asked experts to come into New Jersey to talk to us and talk to our staff regarding permanency strategies, and more important, the need for permanency. I limited my focus of my research to the 304 legal orphans in New Jersey. I then worked with staff to apply the strategies, and then we looked at results. And then we made some recommendations. Some of the recommendations was to, first of all, for our front-end group, was to work in terms of that concurrent planning model. Okay. Once again, utilizing the concurrent planning model, it gets to the core of things right up front. It helps children move through the system timely. Okay. Then also up front, we recommended developing an impact team for teenagers whose goal still is adoption, so that some intense work can be done with them, so that once again we don't give up on them, so that they become a part of that legal orphan population. And then some of the recommendations around back-end strategies. First of all, we recognize that we have to train and support our staff, because we're now talking about a whole shift in the way we do business. And change does not occur easily, in particular in the child welfare system. So that was one of our strategies to get people to relook at our legal orphans, to try to find them families. And another key recommendation was to ensure that the young person participates in his planning. Okay? Include that person as a leader on his own team. Mining the record to go back and look at past connections for the young person. Look in particular at paternal relatives. We often don't utilize paternal relatives as resources. Okay? And then we wanted to make recommendations to our leadership in order to develop a model, a practice model that once again would help alleviate our legal orphan population, and that would stop it from occurring at the front end.
Okay, thank you. So now you've heard how the projects are. They sound really good, right? Sound really hard? Okay, sound real doable. Yeah, we don't want you to feel like that, though, because now we're going to talk about what was the greatest challenge. When you think back to doing your project, I know, Ernest, you talked a little bit about some of the challenges that are going on now. And I want to talk to you a little bit more about even trying to institutionalize something at a university level, because I know that has a lot of learning right in there. Mm-hmm. But when you think about your day-to-day work and this whole idea of having this action research responsibility, this project that you've got timelines, you've got tasks you have to deal with, you've got to talk to Janice and I way more than you probably wanted to. What would you say in all of those things was your greatest challenge in implementing your project?
I would say trying to make that attitudinal shift with staff, because for so many years we had done things a certain way, in particular in terms of finding adoptive families for our children. Once they got to be 13 and 14, we immediately started to say, well, this kid is not adoptable, so we need to return this child to the local office. So now we're saying something completely different, that all children, okay, 14, 15, 16, even up to 21, that we need to try to find a family or a connection for them. So trying to help staff understand, first of all, the need to do this and to keep them focused, because any little thing, the first setback where they say, well, this is going to be pretty hard, maybe this is not a good thing, trying to make them change their attitude so that their behavior would follow.
So that required you really kind of being strong in your topic and being really,
in their face, I'm going to be honest.
Okay. And also feeling very comfortable with your topic as well and your issue. And I think that's a real good point, because I think one of the things I kept telling the first group was, you are the expert in your topic. And that's what I want you to walk away with, if we come up with some points, that as you're working on this, it is your project and you are the expert in it as you're collecting data and understanding, and that helps a lot as you're out here trying to push the issue. Ernest, what would you say was, or push the work, the change in the system? What would you say, Ernest, was the greatest challenge in implementing your project?
Well, the process that we used involved committees to help get the work done. And some of the members of the committee were non-OCFS staff, non-OCFS professionals, I should say. So as negotiations would go on in our home office, I would be privy to information that I couldn't share with the non-OCFS people. Yet we'd have to meet in committee and try to work collaboratively. So you can imagine that that was a source of frustration, to put it mildly, amongst the committee members. So I would think that was the biggest challenge. We asked people to come aboard and be part of the team, but they could only be part of the team to an extent. And that wasn't particularly fair, but that's how business runs sometimes.
And that's a leadership challenge.
Yes, it is.
Often bringing people together and knowing when and what information to share.
And if I may, part of the learning and growing is that you have to be seen as someone who could be trusted with confidential information. Because as the next opportunity arises, you may not be called because you open your mouth prematurely.
Yeah, it's a lot of thinking.
Oh, yes.
Yeah.
From my experience, I didn't really run into a lot of challenges in implementing just from the topic that I chose to look at. For me, it was narrowing down what I wanted to do. There's so many things that were of interest to me, but trying to put this in a framework that I could work in within a year with all the other responsibilities that I had in that position that I was doing. And so I would get those emails from Janice and Sherilyn, and they're saying, you need to submit this. And I'm like, is it time already? Because I was doing a lot of documentation and recording different things, and I was interviewing different people from the counties, and I was pulling down data. It was easy for me to go in because I had numbers with me, and when you have, when you can say these are your stats and these are your numbers, it's hard to argue with numbers. And so we need to talk about what your practice is and how you're implementing different things. So, and then there was just the atmosphere at the Division of Social Services where I worked, where I had a wonderful mentor, and I was allowed to go in, and we had very frank discussions, and the atmosphere around the agency was open for that dialogue. And it did help that we had our Child and Family Services review coming up. So we've already been through our second round of Child and Family Services review, so we were in a position where we wanted to critically think and start trying to implement things that were going to be concerns in the state of North Carolina.
And you said something really important there about data, how strong. I'm going to talk about data, right? Well, for those of you who don't know me, I'm going to say something about data, so just Whenever you see me, just bring it up and then I won't have to. But data is such a huge tool to a leader and to change. And I think that was so important what you said, is that even when people don't want to listen, people will often listen to what the numbers say. And particularly we're living in an age now of performance measurement and evidence-based practice. And so having a good understanding of what the data says, which is part of kind of some of your first responsibilities in your project, will really help you as you're pushing the envelope and trying to get things out of the box. You answered just a little bit, but if there's a little more that you could say about how you fit this, because this wasn't your day-to-day responsibility. I think Ernest probably more you so than anybody. It kind of did fit into your day-to-day responsibilities, but still, how did you bring this back in? How did you organize your week when you sat down to do your to-do calendar? How did you fit it all in?
Well, everybody knew, first of all, what I was doing.
Okay.
I made it my business. The director of the division knew, and the staff under me knew what I was doing. So they actually were all quite helpful, because when my staff would see an article about youth permanency, they would print it out, give it to me. Valerie, we think that this might help you.
Okay.
But I have to tell you, when I got stuck on my day-to-day work, I would put it down. I said, I'm not going to go anywhere with this anyway. Let me do a little bit more on my project. So my project was kind of like a relief from my day-to-day work.
Lucky you.
And then when I was commuting, I would bring my literature with me, and I would read it. I met with my mentor religiously. We both agreed that we could not meet in either one of our offices, that we needed to meet on the food court so that people would not bother us. So I would take my little stuff, and she would come, and we would talk about where I was, where I was struggling. And I have to be honest, I struggled with those logs because I was never at the point where the logs were due. I was never at that point. And then there were technical problems in terms of our server and everything. We had some problems with the log, but it was not hard for me to fit it in to my day-to-day. I mean, things are crazy anyway. So this was used really as a stress buster for me. And I had the support of those around me.
Now, when you said you communicated it to everybody, was it like at a meeting that everybody was told?
Well, when I applied to become a participant, the director knew. She was the one who recommended me. And then I went back. After I found out that I was accepted, I went back to my staff and I told them about it. But at that point, and I'm being honest, my topic was not this, okay? And I have to talk a little bit about that. I had chosen a totally different topic, okay? One that would have been far easier for me to do. But when I was on my way home from this workshop, my mentor and I were talking, and I said, I think I have to do something else, because I need to do something that's really going to challenge me. I was so psyched up, I tell you, from this. I have to do something that's going to challenge me, and I have to do something that is going to help the state of New Jersey and to help our children. So it was like silence, and we're sitting at Ronald Reagan Airport, and we're looking at each other, and almost simultaneously we said, youth permanency. We said, New Jersey is not where it's supposed to do. Our children are just hanging out there. Something has to be done. And so I said, gee, that was always a population that I had trouble with. Certainly when I was an adoption supervisor, I was one of the people who sent those cases back out of the adoption unit to the local office. So I said, you know what? I owe this population something. And so that's how I got started with youth permanency. And then when my staff knew that youth permanency was it for me, they were very supportive. I have stacks and stacks of literature. They would come in, well, how you doing? Where are you? So I really had no problem.
Well, for me, getting more things piled on me, that's just how it goes at work. Y'all know how that is. But I think what helped me the most was just keeping my eye on the prize. I knew I had to be back here in a year. As you go through this process, you'll want to make a good presentation when you come back. 2, we wanted to start a program in September. So we had a structure where you had to fit your time in. So it's, enhancing your to-do list, just adding it in. For me, the quarterly reports to MALDI were helpful because it kept me focused, helped me keep my project organized toward our desired goal. And my supervisor was helpful. She was understanding about the nature of this project. And, maybe 1 or 2 assignments didn't come my way. But other than that, it was, making a way to make it fit.
To me.
I echo what Valerie and Ernest said. The only thing that I would add to the group, if it was any help to you, is just to know your learning styles and what works best for you. Like Valerie, I often would take things home with me in the evening, and then I had things with me on the weekends, or if I was at a conference, I had my materials with me because I needed to have time to focus. And when you're in the office, in my office, the phone is constantly ringing, and you're managing projects and funds, and so you have to avail yourself to do that. You try to carve time out, but then agencies are calling you, and you just don't feel as comfortable doing that. So it's either going to be some evening work for me, or it's going to be something that I want to read and devote time to thinking about over the weekend. So that's how I chose to do it to work for me.
Okay. I'm going to ask you a 3-pronged question this time. I want you to tell me about what kind of changes resulted from your project. You told me a little bit about that, but if you didn't, let's be a little bit more specific about changes in the organizations, changes in yourself, how you do your work now, and if there were any changes in your actual roles and responsibilities as a result of your project. So, again, what changes happened in your organization, changes in how you yourself approach your work as a result of this, and then were there any changes in your roles and responsibilities? And we'll start up again with you, Tamika.
Oh, okay. Well, let's see. That's 3 things. All right, changes in the organization. I think for North Carolina, we have something now at the division called strategic planning, and we're looking at how we're built in our organization, what our goals are, what our missions are, how we communicating that with our local county departments of social services. We've also made presentations myself to the different counties, area adoption meetings. They'll invite me out to come out and make a presentation about disproportionality. And what I will do is I will tailor it to their particular region and their counties. And we will have an open, frank discussion about what's going on in your county. And for some of ours, because Caucasian Americans and then African Americans are a predominant population, we're really talking about those two and it is critical decision-making points and where they're making decisions about children, and do they think that race plays a part? And then when you back it up with the data, as we said before, then they have to assess that for themselves. Where are you with this, and where's your agency? And we foster a dialogue even at the Division of Social Services of open communication. An open discussion, and that was a part of what my mentor brought to the table and what she has fostered. Changes in myself, of course, I'm still willing to question, but also to observe, to listen, and then have an opinion. You have an opinion. If you've done work and you've been in a family, you work with families, you have an opinion, and you shouldn't always be afraid to say what your opinion is. I'm excited about growing. I continue to grow. I think I will grow hopefully until I'm no longer here anymore. So that is my goal. And I'm excited, and that might just be for today, but I'm excited about the potentials and what I think what we can do to try to, the old story, if you can save one or you can help one, that really makes a difference. And that really makes a difference when I'm talking to families, when I'm talking to agencies, when I'm thinking about my work. If it helps one additional person, man, that just multiplies because they have an influence on other people as well. So I'm grateful for that opportunity. My changes in my roles and responsibilities, at the time I was with MALDI, I was the adoption program coordinator. Now I'm the permanency coordinator. And what it affords me the opportunity to do is I am at the table of discussions. And if you've never been at the table or you have been at the table, you want to be at the table, because if your voice is not being heard, you're often overlooked. And sometimes you need to be that voice that says, wait a minute, wait, let's take it back, let's think about this a little bit more. And we've been allowed to do that. I've participated in a Child and Family Services Review, the Program Improvement Plan. I've attended all kinds of conferences and meetings. And then when I come back, I heard my director say one day, we were meeting with Irving County directors, and she says in her introduction of me, she says, this is Tamika. We send her all places. She gets all the information. She brings it back, and we try to put this into policy and practice, and we value her input. And I was like, wow, you do. That's wonderful.
Excellent.
I don't know if that's a good thing, but I appreciate it. If you ask me, I'm going to tell you, and it may not come out the way you want it to, but I'm going to definitely tell you. And then we just do encourage you. It's been fostering an environment where I've really been looked at as, what do you think about it? What is your opinion of it? And so I think more than anything, I'm grateful for someone opening the door. I really don't think any of us are self-made. I think people open the door for you, but you need to bring your skill with you when you come. And so when they say to you that I value your input or I appreciate your opinion, I really thank people for opening that door for me.
Excellent.
I guess the major change in our organization, excuse me, is that we have a new commissioner and a new governor. The commissioner who was primarily responsible for obtaining the funding for this program is no longer with our agency. So our job, my job, between now and the next contract negotiation, which will be sometime in the spring, is to create a strong rationale for our commissioner for not only continuing the program, because as I said earlier, our target population has not been reached, but to really expand the program and make it the program we want it to be. So that's going to be the job moving forward. The changes in me, I guess when you've gone through a project like this and that you feel you've gained success, it does embolden you to take the steps or the risks to do some of the things that are in your responsibility to do to address the changes you want to make. One example was I've always wanted to train our city workers on adoption. New York City. Yes. Yes. And this spring, talking about adoption competency in New York State, I trained 200 some odd city workers on adoption. One, because they're changing their case management model, and it's a phase-in process. Those workers who are going into the new phase, well, they'll get trained. Those workers who are left behind and will be phased out still have the lion's share of the children, but they need to know what they need to know about adoption issues. So that was important to me. Changing my roles and responsibilities, I was given the title of earned the title of adoption coordinator, of project coordinator. Now, what is this project?
Excellent.
The project is the contract which pays my salary, gets me here. The state has a training contract with Buffalo State College to basically have us serve in the role of adoption specialists. Now, there are civil servants doing the same job, but government does what it does to get people in the seats, and that's fine. But in that role, I'm sure it's just a coordinator, but with the title, you do have an opportunity to, plug your issues. And there are disparities between the contract and the civil service staff. And I've been able to meet with our directors and commissioners and such and have them address some of those issues.
Excellent. Valerie?
Well, a couple of changes in terms of the organization. First of all, the interest is once again being focused on our legal orphans. Several of our legal orphans have now some real possibilities for permanency. One of my focus group youngsters, I work with 11 youngsters, and I worked very intensely with those 11 youth. One of those 11 youth is going to now be adopted by his foster mother. Okay, the consent has been signed, and we're hopeful that by the end of this year that that young person is adopted. A couple of others of the legal orphan group, we found siblings, adult siblings, that are now able to parent these young people. So things have happened, first of all, for our young people, and that's what we all are about. And then in terms of the agency, I think we realized that training is necessary, so I was given quite a bit of money to bring noted experts in to work with our staff. So now we've trained a group of staff. It's not enough. We've worked with our recruiters. We've worked with our resource people. So we know that training can positively impact outcomes for children, but we know that it is just the start. Also, in terms of what's happened with our organization, we are now going to have adolescent and youth permanency units to sustain the practice at the field level. Whereas I'm not just going to be sitting centrally trying to do it. We're now going to have units, and we're going to be able to support those units. And also, another significant thing happened, and I'm going to say it now, but it's more like something that's personally happened for me. I've been offered the position of Assistant Division Director over Adolescent and Youth Permanency Services. So I think that that's something organizationally that's going to have an impact, but it certainly does have an impact on me. And I have to tell you that this project has just made me just so passionate about what I do and about how I present my young people. In my presentation, you see that I'm highlighting New Jersey's youth. They're just so important, and I want everybody to understand how important they are and that they need and deserve families. So this project really kind of got me fired up again, because I've been around the system for 20-something years, and I was running out of challenges. So this did it for me. This did it for me.
Excellent. When you think about leadership, and we've got about one or two more questions, you guys are doing great. What would you say was your greatest lesson learned about you as a leader? Ernest, I'm going to start with you.
Well, leadership's a funny thing because it becomes doership. You can do it, Ernest, you can do it. Well, no, that's unfair because we get a lot of help and support, and everyone's a leader in their own way. But I think that the most important lesson for me is, one, believing in yourself and being prepared. If you're going to be up front, know what you're talking about, know what you're doing, do your homework, and be prepared for even more work, because once you've accomplished, people are going to want you to accomplish more. I think that's my main point.
Valerie, I'm still thinking.
Okay.
You can do that.
I think for me, I have a big enough voice. I don't need two. In terms of being a leader, I think that for me, being a leader means that you are resourceful when there are no resources, that you just, you make a way. And that as a leader, you can make people follow you and do whatever needs to be done just because you say so. And you work right there with your staff, and you act as a role model for your staff and for your young people as well. So for me, that's what I think being a leader is all about.
Excellent.
I think as a leader, as was in the presentation by Dr. Mason, is you have to be willing to walk along. That sometimes people will not see your vision when you first see it, or will see the cry and the need for help that you may see because you have a sensitivity maybe to it, or you've studied it a little bit, or maybe you've even experienced it. So I think just being willing, even when you don't have people pushing you saying you should do it, go for it, to believe enough in the vision that you have and to be a champion of it, to believe in it, believe in yourself, and believe that all families really do have strengths, and that your individual contribution can make differences for families. So I think that's what, and if you become the champion, if you have the expert knowledge, you know how, as Tyler Perry can say, when he first started doing his plays, nobody really wanted to support him, but now that he's made it, he can get a lot of people to come in and stand behind him. That once you finally cross some of the hurdles, you will get people that say, I've been with you all along, or I've seen it all along. But be willing to just take them on, too, and say, good, I'm glad you're here now, and not be bitter about it. And, sometimes when your vision is a little off, that's okay, because at least you were willing to think about it and consider things in a different way than maybe you had before. So that's not necessarily a negative thing if sometimes you're off a little bit with what you're thinking about doing.
You didn't have that in your head all the time. You're quick on your feet, too. That's good. Okay, here's the last question. You've given a lot of advice, but is there one piece of advice that you would give to these individuals who, from this day forth, will be starting out on their individual projects? You told them a lot of different things, but if there's one thing that you must let them know before they start out, what would it be, Tamika?
I wrote this down. If you are here, you are already ahead of the curve, whether by your current position, relationship to others, or your personal goals to push yourself. You are already in the forefront. Use your opportunity to learn, subject yourself to instruction, humble yourself, gain wisdom and knowledge, teach others, and then knock down all the doors in front of you.
Excellent.
I guess that said it all.
Yeah.
But in terms of a project, as I said, I was asked to come on this project. And mind you, I never gave up the other project I was working on. But I guess to find something that sparks your passion, because this is a lot of work, it's going to be a lot of commitment, and also something that you know you're going to get support from your agency administration. You have to find that balance.
Excellent.
I'm just going to add a little bit more to it. First of all, and I said a bit about this already, don't be afraid to step out of your comfort zone, because that's where the learning occurs. Do something that is going to be of benefit to the children of your state and that will support staff. And I'm going to try to remember a fortune cookie that I got. It said something like, it's not who you are that will hold you back, but who you think you're not. Okay? So just know that you are strong and that you can contribute and that you can be a leader, and it will happen.
Excellent. I'd like to give our panelists a round of applause. And I'd also like to open the floor. We have about 2 or 3 minutes here for Q&A. We want to stay right on time here. Are there any questions? Of course, they're going to be around the rest of the afternoon, and so you can ask them some questions. But oh. No, James and I have something going on here, but go ahead.
A little different question. You were talking about data earlier, and I heard Valerie, you talked about focus groups, and I wondered about the power of stories with qualitative data. I found it to be really useful in trying to move legislatures and stuff like that, in addition to the numbers. So I was just kind of curious about when you mentioned the data question, the data thing I thought was really cool. And the other question, the common thread about passion, which I thought was, kind of implicit in all that you guys said. So just wonder about the perhaps use of stories as compelling, and then possibly your passion, was that what kept you in the saddle when going that tough? Anybody can answer that.
Sure. In terms of the stories, well, when we did our survey, we certainly asked the parent comments on their experiences, and that's where you really hear the need. That gives you the real information, what's going on in their lives and in their children's lives, that makes the project even more important to get accomplished.
From where we're here in North Carolina, I hadn't said anything about this piece of it. We looked at a lot of the empirical data that we had, but we currently have a proposal that hasn't been funded yet, so I haven't said a lot about that, but it looks very favorable, and we're going to start with 10 counties, and we're looking at working with individual children, but the goal behind all of it is within the next 18 months we're going to make legislative inquiry to our General Assembly, and we will have the stories of those children that were impacted by what we did that follows behind us to try to get additional funding to make this a statewide thing.
Very good.
For me, data certainly was important because I was able to drill down with the help of one of the technical people in my office to exactly who my legal orphans were, how long they had been in care, the fact that one of my 11 had 32 moves. So data certainly was important for me. Actually, I got a lot of data before I even started reading a lot of the literature. Very, very important. New Jersey now, we are a data-driven state. In particular, since we are part of the lawsuit. So we're not just the only ones looking at the data. We have everybody looking at the data, and we certainly better be accurate or we'll be called on it. So data is quite important.
And I think it is important. I think sometimes we just lean with quantitative or the numbers, but the stories are strong as well. Sharon?
Well, for at least one of the states, President, you've already had turned in your self-assessment and then had your on-site review. I think you guys both still have yours.
We haven't had ours yet.
Ours is coming up in 2008 or 9.
2008. How did North Carolina include this information, or did you, in your self-assessment? And the 2 states who haven't had to turn in your self-assessments yet for the CPSR, how might you include that information in your self-assessment?
One of the things that we did put in our self-assessment and also in our program improvement plan is the issue of cultural competence. And we used a lot of our disproportionality status information. Even though that was not something that was a focus of the Child and Family Services Review, we made it a part of our program improvement plan. And then going forth with the proposal that has been submitted, we are specifically focusing on our disproportionality numbers and what we're recommending and hoping we'll get funding for. So, and that's going to be statewide, hopefully.
Well, I can only speculate because we're not close to the self-assessment yet. But the work group that delivered this product was formed through our last CFSR findings. So I can imagine the various products created by the work group will be included in the information provided to the federal government.
And for us, I know that permanency for the longest waiting child or longest waiting children is going to be one of the components that they're going to be looking at this round. So we've gotten the jump on that a little bit in preparing and helping to move things on, and we have things kind of lined up. So yes, we are aware that that's going to be key.
Any other questions? Well, I'd like to thank you. It's a pleasure working with you, and great to hear from you again. And
Yes.
Be encouraged. Thank you.
Sure.